Believe it or not, it's totally normal for yeast to live on the skin. But issues can come up when the yeast tends to overgrow. Let's talk about some of the most common conditions caused by a yeast overgrowth. I'm Dr. Nina Desai, a board-certified dermatologist and mom of 4. I want to help you with your skincare concerns and share a little bit about my life. Don't forget to subscribe below so you don't miss a video. So yeast, in particular the Malassezia yeast, is a microorganism that naturally lives on our skin. But in certain environments or with certain triggers, this yeast can overgrow and cause certain skin conditions. And these skin conditions are actually relatively common. So let's get into them. So first, the condition called seborrheic dermatitis. Seborrheic dermatitis is like an exaggerated form of dandruff. Dandruff that hits the scalp, but seborrheic dermatitis can also hit the eyebrows and the beard and around the nose. This is all caused by the Malassezia yeast that tends to overgrow on our skin. Seborrheic dermatitis tends to be these thick yellow or white flakes. They can be itchy, they can be greasy, they can even be almost pustular in some individuals. The most common trigger for seborrheic dermatitis is going to be stress. Stress on the skin or stress on the body. So oftentimes an individual who is not sleeping well or is not eating well or who has a life stressor going on will notice a flare of the seborrheic dermatitis or a buildup of the Malassezia yeast. The next most common condition we see is what's known as Pityrosporum folliculitis, aka fungal acne. This is actually a misnomer because it's not triggered by a fungus at all. It's triggered by the Pityrosporum or the Malassezia yeast. And what these individuals are going to notice are little white or red bumps that occur in areas where there's heat or sweat buildup. So we oftentimes see it on the forehead, on the hairline, or on the cheeks or down the neck or on the chest and back. And oftentimes the story is that someone sweats a lot, or they started a new workout routine where they're sweating or perspiring more than usual. And this hot or sweaty environment will cause an overgrowth of the yeast. And lastly, we see a condition called Tinea Versicolor. Tinea Versicolor also is an overgrowth of the same yeast, but it looks a little different. What you're going to see in Tinea Versicolor is these scaly patches that are brown or pink. This also tends to overgrow when someone is overheated, sweats a lot, or lives in a really sunny environment. And you will notice Tinea Versicolor hitting the neck, the chest, and the back. Tinea Versicolor is more common in the summer because, as I mentioned, one of the triggers is the sun. Those that go to the beach more often, who are outside more often, they are going to develop more flares of Tinea Versicolor. Oftentimes, it's really hard to prevent these conditions from occurring, but if you have Tinea Versicolor or Pityrosporum folliculitis and some of your triggers are heat or sweat, minimizing the amount of heat or sweat that sits on your skin can minimize your flare of these conditions. So what I typically recommend is after you work out or after you've sweat, make sure you're washing your face or washing your body as soon as you can. So how do you treat these common overgrowths of yeast? First, being on an anti-yeast shampoo is going to be really beneficial. So something like an over-the-counter Nizoral or Head and Shoulders, which are dandruff shampoos but also help to kill the yeast, is really beneficial. What I typically recommend is you're going to lather the shampoo on the affected area, whether it's the scalp, the face, or the body. You're going to leave this on for a couple of minutes before you rinse it off. If you can do this at least 3 to 4 times a week, it's going to be really beneficial at not only treating the yeast, but preventing recurrence of the yeast as well. Along with the Nizoral shampoo, you can pick up an over-the-counter antifungal medication, and that can be used on these areas twice a day as well. But for really stubborn cases, you really want to see your dermatologist because you may need an oral antifungal. And I see this most commonly in those with Pityrosporum folliculitis because the yeast actually has gone deeper into the hair follicle, or those that have really severe cases of Tinea Versicolor where it's all over their chest and back. So the important thing to realize is the yeast overgrowth, while normal, does not correct itself. So in order to get rid of it, you really do need to treat it. And those that are more prone to this yeast buildup tend to have recurrences. That's why it's really important to know what it is, to know how to treat it, and know what your triggers may be. Have you experienced any of these conditions? If so, leave a comment below and share what worked for you. And don't forget to like and subscribe so you don't miss a video.